Hi everyone, this is Rachel here. I'm so excited to see everybody. So for today, this is our Childbirth Masterclass. So for those of you who just are joining now, I would love it if we can just get to each other. I'm getting a little, you know what, I'm going to start this meeting again, okay? So I'm going to see here. Can everybody see the video? You should be able to see the video. And then there is a chat box. You can say who you are and I guess what you would like to learn from this class. I'm very excited to meet everybody. You should be able to see the PowerPoint now. And this is the Childbirth Masterclass. So for those of you who don't know, my name is Rachel. I'm a nurse. I'm also a lactation counselor. So I do a little bit of everything. And I figured this would be a great way for us to kind of just get to know each other and learn a little bit about what to expect during your pregnancy and after as well. So first off, I wanted to go over a little bit about pregnancy, what to expect. And this also is going over a lot of the information that's in my Childbirth Masterclass online. That's on mommydidyouknow.com. So it's a great way to kind of just learn a little bit about pregnancy and everything. So for those of you who are just joining in, I would love to see a little bit more about you. You can just put your name, maybe how many weeks you are, and what you would like to learn from this class. I know that there's so much to learn when you guys are pregnant or expecting a new baby, but at least we can learn together. So for today, let's start with a little bit about pregnancy. I know that there's probably most people that are taking this class are in their second or third trimester. What to expect, of course, you'll start having some nasal congestion even in the second trimester. The first trimester, a lot of nausea sometimes, but what really helps is drinking a lot of water, trying to rest when you can, trying to stay away from kind of greasy, fatty foods, things like that. And then those really help with that. UTIs also can be common in your first and second trimester, so you can drink a lot of water, try to have good vaginal hygiene, perineal hygiene. Peeing when you actually feel like you need to pee is a good, usually pretty good for that as well. And then I see Lindsay, 33 weeks, first time mom in the final countdown, trying to learn everything. Of course, we've all been there and it's very nice to meet you. And I know that as the day starts to get closer and closer, there's so many questions that you guys have. So I'm very excited that we have a nice group today. I was waiting a little bit for some people to log on. And then we have a few other people trying to learn everything that you need. This is my first class about pregnancy, 29 weeks today, first time mom, Naomi. It's so nice to meet all of you guys. I really hope that you can take out something really important from this class and feel more confident about the birth of your baby. And that, of course, as you start going into labor and delivery. So everyone starts thinking about, as the time starts to go closer, is what to expect those weeks coming up to labor. So your baby, can anyone tell me at how many weeks is your baby considered fully term? So when is your baby considered fully term? So anything before 36 weeks is considered early, 37 weeks and above is early term, but when is fully term? And then you can use the PowerPoint as well, but fully term is actually 39 weeks. So anything after 39 weeks is usually when you'll be able to be induced if you wanted to be induced. Usually that's when they'll start sectioning if you're going in for a repeat section and you wanted to be scheduled. It's usually 39 weeks is the earliest that you'll be able to be induced. 40, I know Naomi said 40. 40 is actually when your baby is, it's pretty much the due date is when they say 40 weeks, but 39 weeks is the earliest that you can come in for an induction or for a scheduled section, unless you have some sort of medical issue, such as high blood pressure. Let's say the baby's IUGR is pretty much intrauterine growth restriction. Sometimes they'll see those where the baby's just small, and then they might have to induce you to complete the baby's growing process outside. So there's a few different reasons why you might have the baby a little bit early, but for the most part, it's 39 weeks, and then you'll be ready for delivery. And then, of course, there's different labs that you'll be having as you're going in for your prenatal visits. So as you're going further into your pregnancy, I see a lot of people are in our second and third trimester. One of the biggest things that they'll be checking for is your glucose screen, which is usually around 24 to 28 weeks. But of course, this is kind of guidelines. Some people have it a little earlier, some people a little bit later. But the glucose screen is to check for gestational diabetes. So gestational diabetes is when your sugar levels sometimes are a little bit more elevated during pregnancy, and sometimes you might have to have insulin or diet. Usually it's diet regulations, and then it helps the gestational diabetes. And then a big complication with that is sometimes if you have gestational diabetes, your baby gets a little bit on the bigger side. But for the most part, I see gestational diabetes managed perfectly fine with diet. And diet regulations are normally just kind of limiting your sugars, trying to drink more water. And that includes carbohydrates as well, because carbohydrates actually do turn into glucose, which is sugar. Then you'll have your GBS cultures around 36 weeks to 40 weeks. Hopefully you'll have those before you enter into the hospital. GBS is group beta strep. Group beta strep is a naturally occurring bacteria that a lot of women have in their vaginal area. It's kind of part of the normal flora, because a lot of people don't realize that in the vaginal area, there are good bacteria as well that kind of just helps to regulate and maintain the vaginal flora that's inside your body. So you want to make sure that your flora is in, we'll kind of do the GBS cultures to see if you have group beta strep. Group beta strep is perfectly fine for adults. However, if a child were to have it, if a baby were to have it, it can cause a serious infection. So if you are GBS positive, usually you'll have antibiotics before you deliver your baby. So that's what to expect with that. If you're GBS negative, at least you won't really have those antibiotics and everything like that. And then at 28 weeks, so I have a few people that are beyond 28 weeks, you want to start your kick counts. So this is a very important question for you guys. And I want everyone to be able to stay interactive, stay active as well. So I know that you're paying attention. Is how many times should your baby move pretty much at least in a 2-hour period? So basically what I'm asking you is, if you are doing a kick count, how many times should your baby move? And you can use the PowerPoint if you want as a reference, but this is very important for all moms to know so that you can tell if your baby is decreased fetal movement. And I'll give you a hint, the answer is on the PowerPoint as well. But usually what I like to do for kick counts, exactly. So Brittany knew it's 10 times at least in a 2-hour period. So for a kick count, you don't have to do it all the time. It's best to do it after you eat during the day when the baby's typically a little bit more alert, a little bit more active. So you'll do a kick count. The baby should move at least 10 times within a 2-hour period. And then that will be able to say, okay, my baby is moving. And then, of course, exactly, Naomi said, haven't counted, but about 10. So at least you guys are paying attention. Very good. So it's at least 10 times in a 2-hour period. And if your baby is not kicking the amount of times that they should be, that is definitely a call to the doctor, see what's going on. Another thing to realize too that a lot of new moms don't know, and this is especially important for the ones that are about to be delivering soon, is that as your baby gets closer to delivery and starts moving down the pelvic canal, starts moving down the vaginal canal, even sometimes when it engages with the pelvic bone, you're going to have less fetal movement. So actually, as you get closer to your delivery, you might not see as much fetal movement as you had before, but you would still kind of keep tabs on that. Try to see at least 10 times in a 2-hour period. And then some typical prenatal exams. I want to especially mention these because if we do not, so for those of you who don't know, I work mostly postpartum, but I also sometimes work in labor and delivery. If I work in labor and delivery, I'm taking antepartums, which is usually the people that will have to be admitted to the hospital for observation. Sometimes, and actually, yes, the PowerPoint is actually in the, when you try to sign up for this, to sign up for the class on Eventbrite. When you sign up for the class, that online page actually has the PowerPoint. So on the description, it has a link to sign up for the class. If you sign up under there, it actually has an online page that has the PowerPoints along with free downloadable ebooks. So I know that this PowerPoint is fantastic. So if you would definitely like to get your hands on this PowerPoint, you can sign up for the class there. And I also wrote a few ebooks as well that are about everything from, I have one about breastfeeding, I have one about safe baby care, preventing SIDS, and then I also have a prenatal care downloadable ebook as well. So those are just some great resources that you can get your hands on. So some typical prenatal exams, I want to mention these because if we don't have results for some of these, we might have to redo your blood work, which is definitely something that you don't want to do if you can prevent it, because nobody likes being a pincushion. So blood work, number one is a CBC. That's a complete blood count. The biggest things we're looking for is your iron levels. It's also called your hemoglobin. We're making sure that you're not anemic because, of course, after you have a baby, sometimes your iron levels can go down. Your iron is what carries your oxygen. So if your iron levels go too low, you'll be lethargic. It'll be you can even lose consciousness. You'll be very dizzy. Things like that. So if your iron levels are low before delivery, you might end up having iron supplements during your pregnancy. You might even have IV iron during your pregnancy. And sometimes, especially if you're going in for a cesarean delivery, I've seen some people even have a blood before they deliver to give them a little bit of cushion before they have the baby. Then we have rubella. Rubella is very important to know, not necessarily for this baby, but your next baby. If you are rubella non-immune and you're due, usually you have to have your rubella vaccine every 10 years. If your rubella status is non-immune, unfortunately, you will not be able to take the vaccine during your pregnancy, but you would want to take the vaccine after you have the baby as soon as possible. Because if you were to have rubella, the vaccine is the measles, mumps, and rubella vaccine. If you were to have measles, mumps, and rubella, it can actually cause issues with your pregnancy. So if you were to be infected with the rubella during your pregnancy, it can actually cause issues and even miscarriage. So if you're rubella non-immune, and a lot of people don't even really focus on it. They're like, oh, non-immune, it's just another vaccine. But if vaccines are part of your schedule and you want to stay up to date with that, rubella would be due about every 10 years or so. Then we have RPR. RPR is your syphilis vaccine. Well, syphilis vaccine, I'm thinking of vaccines, but RPR is your syphilis test. If your RPR status is positive, sometimes it happens from a past infection, that whatever happened in the past. If your RPR is positive, a virus stays with you. Pretty much once you have a virus, it will stay with you pretty much for a very long time, if not the rest of your life. However, the ratio of the virus is what they're looking for. So you might have an old infection, which shows that you might have it in your system, but it is inactive. That's not a big deal. However, if you have a new infection during your pregnancy, that is a big deal. So let's say your RPR status is positive, it's reactive, this is a new infection, there's a big possibility that your baby will have to be transferred to the NICU. That's a neonatal intensive care unit. So that's the biggest thing with that. If you had an old infection and they just kind of want to see what's going on now, but it's old infection, everything's fine, your baby might have an RPR test after delivery, but that does not necessarily mean that they'll have any treatment unless that shows up reactive as well. Hepatitis B is another test that you probably saw in your prenatal records. Hepatitis B is a liver disease usually passed on through blood. So if your hepatitis B is positive, let's say you had a past infection, something like that, what to expect for the baby is the baby sometimes will have something called an HBIG, which is pretty much like the hepatitis B vaccine, but it's called an immunoglobulin. Hepatitis B immunoglobulin, that basically is to protect the baby against hepatitis B. So I guess the advances of the medical field are amazing, that even though you might have something like hepatitis, syphilis, even HIV, there are so many different things that we can do for the baby to protect the baby after they deliver. Because the last thing you want to have for a newborn baby is to start that baby's life with a virus. So that's why it's very important. We're checking all these blood tests to make sure that if you are positive for any of these, at least we'll be able to treat the baby and get the baby onto the right start. So the advances in medicine are just fantastic. Then we also have group beta strep, which we talked about before. If you are positive for that, you might have to have some antibiotics before you deliver. And then if you do not get the adequate amount of antibiotics, sometimes your baby has to have extra tests and extra labs to make sure that the baby does not have any infection. And then I just wanted to talk a little bit about prenatal complications. So there are different prenatal complications, but the first one I want to talk about is diabetes. Of course, I did mention that a little bit. And diabetes, it's very important. If you do show your glucose tolerance test comes back a little weird, that you definitely look into your sugar levels. And you can actually on Amazon get AccuCheck machines. That's what it's called. It's called an AccuCheck machine. You can get one for very cheap on Amazon, and you can even get it through your insurance as well. Most OBs will write a prescription for it if your glucose tolerance test comes back weird. And by the way, your gestational diabetes, just because you have it during your pregnancy does not mean that you will have it after your pregnancy. Usually it goes away on its own almost immediately after delivery, most of the times that I've seen. So symptoms: thirst, hunger, fatigue. Doesn't that just seem like pregnancy? So that's kind of what's dangerous about gestational diabetes, is that a lot of these symptoms are pretty much normal symptoms from having a baby. But then in addition to that, of course, you'll see the high blood sugar that you'll see from your AccuChecks, glucose tolerance test. And for those of you who have not had it, it is a very interesting test. You'll normally have to have a fasting sugar. Then you'll take a really, really super sugary drink. They'll wait a little bit, take a glucose test after that, and they'll see how much your glucose levels rise. If your glucose tolerance test comes back a little elevated, usually it's diet changes. Sometimes it's insulin injection, sometimes it's pills. It all really depends on your case. Complications: C-section. If your glucose levels become too out of whack and there's nothing they can do to protect you or the baby, they might have to do a C-section. And then high birth weight babies that are born by moms who have gestational diabetes, usually all of that extra sugar is going through the placenta and giving baby a ton of extra nutrients that sometimes they don't necessarily need. So the baby sometimes ends up really big. Then one very important complication that I want you guys to realize, because gestational diabetes is actually very common, is that let's say you have gestational diabetes, you have a ton of glucose coming to your baby, baby's born, the placenta is cut off and the baby is not receiving all of that glucose from you as previously. Your baby sometimes needs a little bit more time to react to that, to respond to that. So sometimes that baby will be hypoglycemic, or that baby, in other words, might have low blood sugar after delivery, because that baby's used to receiving all of that glucose. Then all of a sudden the placental supply is cut off and their body needs some time to respond and transition. So that just because your baby starts off with low blood sugar does not necessarily mean that they're going to have problems for a long time. It's just sometimes they need to transition, so we'll work with them. And then when you're hypoglycemic, also sometimes if the by mouth feedings are not working, whether it be breastfeeding, formula feeding bottle, whatever is going on, sometimes they might have to even do IV fluids. So that's another thing to think about as well. Next, we have preeclampsia, which is high blood pressure. Symptoms of high blood pressure usually show up when the blood pressure is very, very, very high. That is why high blood pressure is also called the silent killer. So just because by the time the symptoms come up, it's usually too late. And when your blood pressure becomes too high, that's when you can even have seizures and other different complications. So if you are having high blood pressure during your pregnancy, make sure that you're continuing to follow up on your blood pressure tests. Amazon, like I mentioned before, I'm a big Amazon buff. I love Amazon. They have really great blood pressure machines that you can use. And even your doctor might be able to write your prescription for one as well. So symptoms of high blood pressure: blurred vision, headaches, stomach pain, swelling, all of those are different symptoms of high blood pressure. Swelling is normal during your pregnancy. However, if it becomes very extensive swelling, or we call edema, in case you hear those words, we're looking, all right, if there's a lot of edema, could it be from preeclampsia? Could it be from high blood pressure? So that is what we're talking about. If you start hearing all the nurses and doctors talking about that, that's what we're talking about. Treatments are early delivery. It can be as early as 20-something weeks at some points. If your blood pressure is running so high that they cannot control it, there is a chance of having to have an early delivery to make sure that you and your baby are safe. If you also have high blood pressure, another thing to think about is high blood pressure. What it causes a lot of restriction on the placenta coming to the baby, all of those nutrients coming to the baby. So sometimes you'll even have a small birth weight baby. So that's completely the opposite of gestational diabetes, where gestational diabetes, you might have a very big baby. With preeclampsia or high blood pressure, sometimes you'll have a very small baby because all of that extra pressure on those blood vessels are causing restrictions on the nutrients going to the baby and the oxygen going to the baby. So that's why sometimes that might even lead up to IUGR. As we were talking about before, IUGR is intrauterine growth restriction, where all of a sudden your baby just stops gaining weight, stops growing. So we talked a little bit about pregnancy. Now I just wanted to discuss a little bit about the signs of labor. And if anybody has any questions about anything, you can always text me, you can call me, you can even write it on the chat, whatever you want to do. I'll be more than happy to answer whatever questions that you have. So I would like to know, and all of you guys can stay interactive with this, what are some signs of labor? And if you can even tell me, would be great, the difference between true labor and false labor. So if you guys can tell me some signs of true labor. And so there is such a thing called Braxton Hicks, which also sometimes can even start as soon as your second trimester sometimes, where you'll just start, they're like practice contractions, where all of a sudden your uterus kind of starts practicing for delivery, getting ready for delivery. Does not necessarily mean that you are going into active labor, but sometimes your body starts getting ready for it. So those practice contractions sometimes do occur because your body is getting ready for labor. So who can tell me the difference between true labor and false labor? So I'll give you a hint. True labor is characterized by regular and intense contractions. Usually true labor, you can't really talk through. With false labor, I remember with my first baby, I didn't really recognize the difference between true labor and false labor. And I remember with my first son, I went in for a labor check because I started getting Braxton Hicks, and I went in for a labor check and I come in with a big smile and I'm like, oh, I think I'm ready to have my baby. This is wonderful. And then they're like, yeah, I don't think you're in labor. So they did they hooked me up to the monitor, and I realized that my contractions were not regular. They were very irregular, as a matter of fact, and they were not very intense. However, with my second baby, I went into labor by myself, and they did go from irregular and then they went to regular. And then I knew, oh, wow, I think I am in labor. So the regular contractions intense was huge difference. And then Naomi did say that a sign of true labor is your water breaking. Yes, that is a great sign that you're in labor. However, keep in mind too that sometimes your water does not break until very far down in your labor. I know that people, they're always thinking of the movies where in the movies they're at a baby shower or something, and then in the middle of the baby shower their water breaks and they're like, oh wow, look at that, I'm in labor. But actually in real life, sometimes the water does break a little before you actually start going into active labor, but the majority of the time you can be in active labor for quite some time before your water does break. So the big thing that you can show, that you can see, is regular intense contractions. And yes, of course, your water is breaking. Bloody show and even your mucus plug coming out, there are also signs of labor. And then another thing is called lightning. So lightning, basically what happens is the baby starts moving down the vaginal canal and starts, especially engaging in the pelvis, you'll notice it's something called lightning, where it's like, boom, you're like, wow, what just happened there? And you're just feeling that baby come down. And sometimes you might even see all of a sudden your belly drops. Your belly usually drops a little bit before you go into true labor. So those are some signs of labor and some ways to distinguish between false labor and true labor. Now I have a hospital bag checklist, and I have this whole checklist on mommydidyouknow.com. You can go on mommydidyouknow.com, search for hospital bag, and you'll be able to see this whole checklist with everything that you need and everything that you don't need. So usually things that you do not need. The hospital normally provides you with diapers and wipes. They'll also support you with an abdominal binder. Usually, if they don't give one to you, you can always ask for one. They also do give you pads and underwear, but you can use your own. Most hospitals do provide a breast pump, but I would ask ahead of time just to see if they do have one. Keep in mind too that a breast pump is not really necessary in the beginning unless it is you have a separation between you and the baby. If you have a separation between you and the baby, then you might want to have a breast pump to make up for your lost stimulation. Now, how regular is considered regular? How often do you feel contractions that it is considered a sign of labor? Now, regular can be 30 minutes, can be 5 minutes, can be 10 minutes. Usually, when we have someone on Pitocin, it's normally about a contraction every 3 to 5 minutes. We're like, okay, so maybe they're, really 2 to 3, but when they're between like 3 to 5, every 3 to 5 minutes, we're like, all right, it seems like she's probably in active labor now. And then how often do you feel the contraction is considered a sign of labor? So it's pretty much, it can be regular, it can be 3 minutes, 30 minutes, but as long as it is regular, and then you'll notice that it'll be contracting more. And one way that you can see also is that you have your nose, you have your chin, and you have your forehead, right? So a strong contraction is actually what you'll feel here in your forehead. So you'll feel your forehead, you'll feel how hard your forehead is. That is a hard, severe, heavy contraction. So when you feel a contraction, actually put your hand on your belly. And when you put your hand on your belly, you'll actually feel kind of density changes. If you feel your nose, it's kind of soft, you don't really feel anything. That's just kind of a mild one. You feel your chin, you start feeling a little bit heavy. Okay, that's a medium one. You start feeling your forehead, that's heavy. So you can actually feel the difference there. And then, is it similar to menstruation pain, and does contractions come and go, or is it supposed to be in pain for 5 minutes, stop, and come back again for another 5 minutes? That was another question that we just had. So your contractions should not last really more than a minute or so, especially if it's not really going to be in pain for 5 minutes. Usually what you'll see is you'll have a contraction, you'll have a period of rest, then you'll have a contraction again. The most common reason that I see some people have contractions back to back is because of the Pitocin. Pitocin sometimes is necessary. I had Pitocin with both of my kids. However, sometimes when they're not monitoring the Pitocin very well, or if they need to lower the Pitocin for whatever reason, what happens is the Pitocin causes your uterus to contract. It's called a tocolytic. Now, what happens when you have too much Pitocin and the rate needs to be decreased, your contractions will almost be back to back. If it's not that beautiful, every, 2 minutes or so, and with a nice rest in between, we're like, all right, there's too many contractions. The uterus is overstimulated. We need to decrease the Pitocin. But during those resting times is when you'll be able to breathe and you'll be able to kind of recuperate. And then for pushing, you'll start feeling kind of like rectal pressure, because it's very similar there. So as you are in labor, you'll start progressing. And then when it's actually time to push, you'll start feeling that it's kind of like a ring of fire too, when the baby actually comes out and is crowning is what they call it. But we'll go into labor a little bit more as well. But these are fantastic questions. So when you get to the hospital, bring your prenatal records if you have them, even if you have them on your phone, because remember how I was talking, if we don't have records, we might have to repeat your tests. So if you have the prenatal records on hand, it will be a great way that you'll be able to hopefully avoid some unnecessary treatments and tests for both you and the baby, especially because some of them are very expensive. Like hepatitis B, if we don't know the hepatitis B status and we have to give HBIG, HBIG is actually very, very expensive. So that's definitely even some money that you can save just simply by having your prenatal records. And usually they'll give it to you around 36 weeks or so, but it's good to have it just in case. Some hospitals and doctors' offices are connected, but it's still good to have your own, because I've seen it sometimes on weekends where a patient might come in and the office didn't send the prenatal records yet. And, all of a sudden we're stuck. And even though they had prenatal care, we don't have their records. It's the weekend, we can't get them. So then of course we have to draw everything over again. So by coming in with your records, it's a great way that you can kind of avoid that. Try to bring money to what we're doing. I know everyone's asking about COVID. So for most hospitals right now, especially in maternity, mom can have one support person for the duration of their stay. Usually it's the same, because I've talked to different people who work at different hospitals, and that person can stay with you for the duration of the stay. However, what you can have is you can have people bring stuff from the outside if you forget something. So sometimes I'll have someone that like all of a sudden came into labor, they came into the hospital, they're like, oh man, I didn't bring anything. So sometimes what I'll say is, hey, why don't you have your family members? They can come, they can bring you whatever you need, then at least you'll be comfortable. If you do have some time to pack your hospital bag, that would be great. You don't need to pack that much. I've seen people like pack their whole room or like the whole nursery, but you don't have to pack too much. You can pack a few pairs of clothes for you, few pairs of clothes for the baby. I usually recommend people to wear their own clothes, just because if you are in the hospital gown or the hospital clothes for the baby for too long, kind of makes you feel like an old man, especially if you're in the hospital gown for a long time, you just had a baby. The first thing that you want to do is take a shower and change your clothes. So that actually having some clothes will definitely help you out. Really, the only stuff you really have to bring is stuff that makes you feel comfortable. So blankets, shoes, things like that. Those really help just to make you comfortable. And actually, one kind of nursing tip is bring an extra long charger That way you don't have to, like, make sure if you bring a charger, make it kind of long. That way you don't have to keep like bending over, getting out of bed, especially if you're having an epidural and you can't really get out of bed that often. At least you'll be able to have a charger so you don't have to get out of bed too much. So we talked about pregnancy. We talked about gestational diabetes. We talked about your labs. We talked about, so you start getting into labor, you're having regular intense contractions. By now you've probably have your hospital bag ready and you're ready to come into the hospital. Now everyone starts asking about vaginal exams. When you go into the hospital for labor, especially if you're having a labor check, they're going to hook you up to the monitor. The monitor is checking a few things. One is checking your heartbeat, checking your heart rate, checking the heart rate of the baby. And then another thing that it's looking at is your oxygen levels. So we want to make sure that your oxygen levels are good, because whatever oxygen that you're taking in is also going to the baby. So you have the monitor for your heartbeat, you have the monitor for the baby's heartbeat. Oxygen is up in there as well. Now, another test that they're going to be doing is your vaginal exam. They'll want to see if she's in labor. Is she in active labor? Is the baby coming? Is the baby in the correct position? Things like that. And I know that sometimes as patients, everyone just kind of like sits down, opens their legs, and they're like, all right, doc, just do whatever you got to do for me. But you want to make sure that you are an active participant of your medical team. So you want to know what they're checking and what happens if what they're checking for does not exactly go according to plan. So number one is dilation. That's what everybody knows, is how open or wide is the cervix. You know, you're in active labor once you're about 4. It's early labor is 1 to 3. You can actually sit at between 1 to 3 for months even. Actually, with both of my babies, I was 2 centimeters dilated for, I think when I hit like 34 weeks, I already was 2 centimeters dilated, and I start freaking out. Oh my goodness, I'm gonna start going into labor. But then finally, when it actually was my time, it went really, really quickly, because at least my body was already kind of close to delivery. So we have 4 centimeters, you're in active labor. Usually that's when, if you wanted to have an epidural, I usually recommend around 4 to 5 centimeters, just because you want to make sure that you are actively in labor and that it will progress effectively. Next is ripeness, is the softness of the cervix. The cervix needs to be soft in order for dilation to occur. If you're not dilated and need to be induced, or you would like to be induced, they might give you a cervical ripener. Cervical ripener, the most common one's Cervidil, but they do have a few other ones. Now that is just something that will dilate you for delivery. So let's say you have to be induced for whatever reason, but your body is not ready for it. So let's say you come to 39 weeks, you were coming in for an induction, whether, you know, it could be IUGR, it could be your blood pressure's high, it could be your decision to get an induction. The first thing that they'll do is they'll ripen your cervix before you start actually getting, ready for your labor. So they'll dilate your cervix with the ripener, and usually that'll happen overnight. So if you are induced, let's say, they say, come to the hospital at 7 p.m., usually they're asking you to come at 7 p.m. because you'll have to get the Cervidil first. Usually that Cervidil, let's say you'll come in at 7, let's say you'll have the Cervidil around 10. In the morning, they'll take the Cervidil out, and then they'll see if that cervix is nice and soft and ready for dilation. If it's ready for dilation, that's when they'll say, okay, let's start putting the Pitocin, let's start getting the uterus ready for delivery. Sometimes the Cervidil by itself puts you into labor. So just because it's kind of a slow way to ripen the cervix. If your cervix is already soft, like for me, mine, like when I came into the hospital with both my kids, my first I was induced, I was already 100% effaced. My cervix was already soft. I was already dilated. I did not need the Cervidil. Then I just came in for my induction with my first baby. I came in with my induction. They just hooked me up to the Pitocin, and then I was able to deliver the baby, which is a minimal amount of Pitocin, and that was it. So your induction experience might be different depending on how your body is and how ready your body is for delivery. If it is already ready, all they have to do is give you a little nudge. So that's more, rather than an induction, it's kind of just, helping along the process. So ripeness, how soft. Dilation is how open. Effacement is how thin. So it's a 0 to 100%. So if your cervix is thin, then it's a lot easier. It's thin, it's ripe, it's opening. It's easier for you to start delivering your baby. Now, station is important too. You might start hearing station. Oh, the baby's at +2, baby's at +1, baby's in -2. A lot of people don't realize what that number is, and that's actually the position of the baby in relation to the pelvis. So let's say you come in for your schedule. Let's say you come in for your scheduled induction, let's say, and they say, okay, she is 100% effaced and the baby's at 0 station. 0 means the baby's engaged and, ready to go. So that'll probably be a pretty easy delivery. But let's say you come in, they go, oh, she's 0% effaced and the baby's at +2. That means the baby's not even engaged in the pelvis. The baby's just hanging out over there and your body's not really ripe. In that case, sometimes they might reschedule your induction. Sometimes they might still do the induction with the Cervidil. It really depends on the case. They might say, hey, walk around a little bit and then come and see what happens. So it really depends on the case. But station is how is the baby in relation to the pelvis? Is the baby engaged in the pelvis or is the baby still floating up in mommy? And then if you are being checked and like, oh, the baby's a -2, the baby's at +2, then the baby is coming fast. And I think I actually got that mixed up. But the negative numbers is not engaged. Positive numbers are the ones that are close and coming fast. I'm sorry if I switch that up, but negative, still floating up in mommy. Positive is coming really fast. Then your position. Is the baby head first or is the baby feet first? If actually the other day a doctor was like, oh yeah, I did a vaginal exam and the baby shook my hand. That could happen. It can tell a lot about your labor just by in relation to the baby and the pelvis. So if the baby's feet first, you might have to have a cesarean delivery. If the baby's head first, that's, what we definitely want. And then the position of the cervix moves from posterior to anterior as you progress through labor. So here is a study question for you guys. I hope you all are listening. So I want yes or no. Does this person seem like she is in active labor? We have, let's say, Miss Mary. She comes in. She is 4 centimeters dilated. She is 100% effaced. Baby is at +1 station. Baby's head first. And the cervix is anterior. Yes or no? Is this baby ready to go? Is this mom in active labor or is she not in active labor? So she is anterior cervix. The baby is +1. The baby is at +1 station, head first. Cervix is 100% effaced. And we have 4 centimeters dilated. Exactly, Samantha. Yes, everybody is correct. She is ready. Yes, so if you come in like that, you are ready for delivery. Good job, everyone. You all get 2 A+. By the way, as we are going through everything, I do have all of this information is actually part of my Childbirth Masterclass. If you have checked it out, it's an amazing, amazing class. This is actually maybe 2 lessons out of it. So it's not even that much. If you want to know more about your delivery, I highly recommend you to check it out. It's on mommydidyouknow.com. If you signed up for the class, you'll see it there. You can also see the link on the description. But I actually have a 26-day childbirth masterclass. It goes over everything from labor, goes over pain management, goes over even breathing techniques, goes over lab work for baby, and those are only the first few lessons. The second half of the class is dedicated to baby care. It goes over breastfeeding, it goes over pumping, it goes over what to expect. It even has CPR instructions, it has circumcision instructions, it has a lot of great information for you. So if you haven't started the Childbirth Masterclass, it is great. And I have great news for you. I'm actually starting a new promotion where I will be giving one lucky person the Childbirth Masterclass 26-day course for free that is in this class today. So I just want, I will be giving it to somebody that is obviously interactive in the class, and I will be giving it away as part of our, when we end the class, I'm going to have an exam. And then in the review exam, whoever is active and participating in that review exam, they will be eligible for the giveaway of the free class. So we have a question. Do you actually feel yourself dilated? Which comes first? Is it a contraction or you feel yourself dilated? Actually, I never felt dilation. You don't really feel dilation. Dilation is kind of a muscle reaction to the contractions. True labor will cause a cervical dilation. False labor does not cause cervical dilation, but you do not really feel your dilation until you are maybe like 10. Then, of course, you'll have a lot more pressure more than anything. Those are really what's to look out for. So I have all these questions. And if you have more questions, I also do consultations as well. And also my consultations come with the free childbirth masterclass as well. So if you have any consultations with me and you want to kind of have a class one-on-one with me, we can always talk directly, just me and you, and we can go over any questions that you have. And it will come with a 26-day course for free as part of it, just because I want to make sure you guys learn and that you are that you're confident. So I have some tips to progress labor, and if we do meet one-on-one, I can help with your labor management. I can help. I'm not really a doula, but I am a nurse, and I am a lactation nurse as well. So I can help you during your labor, after your labor, or like after you have the baby. Let's say before you want to just have a little refresher of what to expect. You can always have a consultation with that. So number one, keep calm. Stress will prolong your labor and prevent you from dilating. So your body needs to relax. Like for me, with my first baby, I was not very relaxed. I was in labor for 18 hours and I had a lot of pain, and then I ended up getting an epidural. And then that's how I really calmed myself down. I was able to relax. And then I started pushing within an hour after having my epidural. And actually with me, I was in labor so long and I was not really progressing that they even were contemplating C-section. But thankfully, once I calmed down, the baby came right away. Number two is manage your breathing. Labor naturally will decrease the level of oxygen going to your baby. That's because each contraction constricts the blood flow to the placenta. So as you are laboring, you need to control your breathing. One way that you can really quick, easy exercise is you pick a focal point that is in front of you. So just whatever focus point you want. Let's say it's a clock, say it's a spot on the wall. Let's say it is your support person. You pick that focus point. You breathe in through your nose, 4 counts. 1, 2, 3, 4. Then you breathe out 4 counts. 1, 2, 3, 4. By doing that 4 in, 4 out, that does help with your breathing. Just keep in mind whatever oxygen that you are getting, your baby is getting as well. So sometimes if your baby is losing oxygen, your baby has a low heart rate, first thing that they're going to do is they're going to stop the Pitocin and they're going to put you on some oxygen. That is because the Pitocin is causing your contractions. They'll want to stop your contractions for a little bit, or at least limit them. Then they'll put on your oxygen to give the baby a little buffer. That way, as you're contracting, it's not contracting as frequently, and the baby will have some time to rest in between. Number 3 is keep your bladder as empty as possible. If you have an epidural, you'll have a catheter draining your urine unless it's a walking epidural, which is very, very rare. But usually you'll have a catheter with an epidural. And then you'll also have a catheter with a C-section, but that's a little different. Manage your pain as needed. Make sure you discuss with your healthcare team your wishes in regards to pain management. You know, if you're in too much pain, it'll place more stress on the body. It'll make it difficult to breathe. So those are different things to think about. Then I have just a basic rundown of pain relief methods here. So most people, when they get into the hospital, they'll start off as they're in early labor with some non-medicinal pain relief. They'll start out maybe with aromatherapy. They'll start out with some massage, Lamaze classes, acupuncture. Sometimes even they'll have water. Some people have like a tub. You know, those are all non-medicinal pain relief. You can even, for aromatherapy, you can bring cloths, put whatever essential oils or things like that, and you can actually have your aromatherapy during your labor. Keep in mind, most hospitals don't really allow the humidifiers and diffusers. Some of them do, but they will allow aromatherapy if it is coming from, let's say, a cloth or something. You know, that's perfectly fine. Then we have a Lamaze breathing techniques. So I'm not a Lamaze instructor. I know basic breathing techniques, but the basics of any Lamaze instruction is breathing. It's trying to stay calm, and it's picking a focal point. Those are the basics of all Lamaze that you'll ever have. IV pain medication is, some people will choose those. IV pain medication will go through the IV. It's not an epidural or a spinal or anything like that. However, those such as Demerol and Stadol, they sometimes make you a little bit drowsy, sometimes a little out of it as well. So just keep that in mind for when you are getting a Demerol. It might make you a little sleepy. Also, Stadol and Demerol sometimes does cause respiratory depression in a newborn after delivery. So let's say you have Stadol and then all of a sudden your delivery comes and you deliver within an hour or so. Sometimes your baby might have a little difficulty breathing and might need a little bit more time to transition, but then we'll get pink up and be just fine. Epidural, of course, is an option as well. That is when they obviously are doing the needle, which is a pretty big needle too. You'll probably have a bolus of fluids before, because the biggest side effect of an epidural, an immediate side effect anyway, is decreased blood pressure. So they might give you a bolus of fluid before just to keep your blood pressure up. Then after delivery, biggest side effect of an epidural sometimes is called a spinal headache, and that happens with a cesarean delivery and spinal as well. That's what happens when your fluid balance is in that epidural or spinal space is kind of out of whack, and then you start having a headache, because as you lay down, it's good, but then as soon as you stand up, that fluid imbalance starts to happen, and then you'll have an intense headache that only goes away when you are flat on the bed. If that does happen to you, let your doctor know. There are different treatments. The most common is caffeine pills, and sometimes they might do a blood patch as well. So those are different treatments. Then for cesarean delivery, spinal and general are the two biggest ways that you'll have anesthesia after your delivery. Spinal lasts a little bit different than an epidural. It lasts longer. Epidural normally wears off about 1 to 4 hours, depending. Spinal anesthesia, however, usually lasts about 6 to 12, just because depending on the person, but it lasts a lot longer. So you'll probably be walking a little bit later than if you had an epidural. General anesthesia is usually in the case of emergency situations, or if they're not able to do the spinal. That is when you are pretty much completely out, and that is kind of a last resort. Let's say the baby's in extreme distress. They only have a few seconds to get the baby out. They might quickly put you under. That's general anesthesia. It's kind of more of an emergency situation. And then it's very important to discuss your pain relief wishes with your healthcare staff. Be open to change as it arises. And go for that. Then this is information on epidurals, which we pretty much talked about a little before. And then I want to have a little review with you guys. So we have a few more minutes. And then for the review, everybody who is active in our review will be eligible for the free giveaway of my Childbirth Masterclass. Anybody who wants a consultation with me, you can also see on the description of this, it should be here. Yeah, okay, perfect. On the description of this video, it says like connect with Mommy Did You Know, private consultations. You'll see it on the description. That is how you can schedule a visit with me. You can also email me at mommydidyouknow@gmail.com. And those are just wonderful because it also comes with a free goodie bag, which has my PowerPoint, it has my downloadable ebooks, it comes with unlimited support for me because I really love to help you and your family. And then of course, it also comes with my 26-day class. So the consultations range, I mean, from $40 to, whatever package you need to suit your family's needs. I have some people that want, 3 visits scheduled. So it really depends on what you and your family need. So someone says, I'm 38 and 5 and I have been having period type cramps. What could this be? So that could be Braxton Hicks. Usually around that time, most of the time it's Braxton Hicks. However, it becomes more regular, more intense. If you lose your mucus plug, if you start having bloody show, definitely talk to your doctor. But that's what it feels like. It's period-like cramps. Anyway, so let's do a little review. Everybody who is participating in the review will be eligible for my giveaway. And then anybody who wants to schedule a consultation can do so by emailing me or contacting me through the description. So number 1, let's see. How many times should you feel the baby move in a 2-hour period? So that's question number 1. How many times should you feel the baby move in a 2-hour period? So we're talking about kick counts, and you should start doing that, especially when you are in your 3rd trimester or so. And you should do that after eating food, usually after eating, because then at least the baby gets a little bit more energy and everything. So good. I'm so excited. You guys have been paying attention 10 times. Next, what are some complications of preeclampsia? Now, remember we talked about high blood pressure. What are some complications of high blood pressure? And you can talk about complications for mom, complications for baby. You can talk about the symptoms that we discussed. By the way, we did not talk about the ranges of blood pressure for preeclampsia. Usually 140/90 is considered preeclamptic. It's something that's a little bit elevated, but we will just keep tabs on it. You might have a little something. 160/110 is usually very, very high, in which case usually we'll definitely start treatment, maybe some IV. Exactly. Good job, guys. So we have blurred vision is a symptom of preeclampsia. That is high blood pressure. So we have headaches, changes of vision, shortness of breath. All of those are signs of preeclampsia. We also have the swelling. Exactly, Alyssa. Now for baby, it's actually low birth weight for preeclampsia. High birth weight is more if you have gestational diabetes, because you are providing more glucose to the baby. With preeclampsia, however, you are increasing the pressure on your vessels. And then when something increases, the vessel is not dilated that much to provide more oxygen. Therefore, the baby has growth restriction. So very good, guys. One that I did not see, and we did see C-section, one that I did not see listed actually was seizures. As your blood pressure gets higher, of course, you are at a higher risk of seizures. Now, what are some signs of labor? That's my labor and delivery question. So what are some signs of true labor? Now you can talk about You can talk about the contraction. You can talk about the frequency, anything like that. What are some signs to show that you are in labor? You can talk about effacement. You can talk about position if you want to discuss, you know, the vaginal exams. And these are fantastic to know as well. And by the way, you can still sign up for more classes because every class is, you know, a little different because they kind of gauge what we will discuss. Actually, next week, I'm going to focus more on baby care as well. And sometimes it's good to have a little bit of a refresher, but you can sign up for as many classes as you want. So you can sign up for this class, you can sign up for next class, and on the description, you'll be able to see all of the different classes. Perfect. So we have regular contractions, intense contractions, bloody show, water breaking. I'm so excited you guys were paying attention. Yeah, exactly. Water show, water breaking, bloody show. You guys are fantastic. And then who can tell me about oxygen and labor? So oxygen, why are we looking at the mom's oxygen level? Or why is that important in regards to baby's heart rate? So like if mommy's heart rate goes down, what are we looking at oxygen during labor? Like, why is it important for us to breathe right? Why is it important for us to maintain good oxygen, stay nice and calm? And actually, Naomi was right, dilated to 4. That is correct as well. So oxygen use during labor is important because you want to make sure as you're contracting, your baby will lose a little bit of oxygen during that contraction. So they might be looking at mom's oxygen levels to see maybe they might need to pump up that oxygen just a little bit so that the baby can get it. So sometimes you might have oxygen during labor, not necessarily for yourself, but it's more for the babies. But yes, exactly, Jessica, because contractions sometimes cause the baby's oxygen level to decrease. So that's why sometimes they might have oxygen during labor to kind of help to regulate that. So perfect. We had a bunch of people that were active during the exam. So all of you guys that were active during the review, I want you all to pick a number from 1 through 10. And whoever picks my number will be the winner of my free childbirth masterclass. So pick any number 1 through 10. Doesn't matter which one. But it was a pleasure to work with you guys. And then if you can also, I would love to know what you guys thought was the most exciting part of this class, or what was something that maybe you didn't know before that now you do know, something that that you thought was important to know that you probably didn't know before. I'll give you guys just a little bit more time to put in your numbers. And I think we might have a winner already, but I just wanted to say it was nice to meet you guys. I hope that we all stay connected. On mommydidyouknow.com, you'll be able to see the blog. I have more classes there. You can sign up for consultations as well. And consults are fantastic because at least we can talk one-to-one. We can even do consults as you're in the hospital. Let's say baby comes and you want to know about nursing your baby, or you want to know about the tests that they're doing. You know, at least I can help you guys with that. So Jessica Poole was the winner of my Childbirth Masterclass giveaway. Yay, because my number was 7. So Jessica, what you can do is sign up for the Childbirth Masterclass on the free trial, and then send me an email at mommydidyouknow@gmail.com. And just let me know the email address that you used, just because I know that, you don't want to probably share your information and, on public. So all you have to do is sign up for the class, the free trial of the Childbirth Masterclass online, and then just email me with the email address that you used. And then I will be upgrading your package to full, so you won't have to do anything for that. The free class comes with 4 days of lessons. The premium childbirth masterclass comes with 26. So you will have plenty to learn. You'll be learning about baby care. You'll be learning about mommy care. I even have a bunch of videos on there about everything from like CPR to circumcision care. I even have some of them with the actual hospital medical equipment, which is fantastic. They actually let me use it so I can do some of the educational classes for you guys. So I love that you guys, let's see, you said general anesthesias for emergencies. You enjoyed learning about that. You appreciated the signs of labor and what to expect from my body adds to my empowerment. Exactly. That's what I'm here for. My job is to make sure that you guys are educated, you're informed, you can make great decisions. I'm so happy that you guys learned a lot, and I hope to stay in touch. You can always email me anytime, mommydidyouknow@gmail.com. For those of you who did not sign up for the class, you can always sign up for the next one on the description. And then those who did, you'll also be getting a link to review on Google, and those really help as well, just to kind of share these resources. A lot of people don't even realize that resources like these are out there. And then of course, the most amazing thing that you can do, like with anything, is word of mouth. So if you know anyone that's pregnant, if you know anyone that's breastfeeding, that is expecting, and would like some more information, you can always refer me to them or refer them to me, whatever you like. And I do speak Spanish as well. So if you have Spanish friends or family that would like consultations to learn a little bit more about their pregnancy, about their baby, I would love to be a part of your guys' journey. And then, yeah, it seems like love the signs of labor and things to look out for. So this was an amazing class, huh? So I'm so excited that we got to talk to each other, and you guys can also subscribe, like this video, and I hope to see you guys in my next class. It was a pleasure. And remember, I think it was Jessica. Yeah, Jessica that won. You just email me with the email address that you used to sign up for the Childbirth Masterclass, and I will upgrade your package. All right. It was a